Prime Minister.
Well, thank you for joining us this afternoon. It's been another very positive and meeting of the National Cabinet today. We've made a lot of progress over the course of this week in putting together the new recalibrated arrangements for the vaccination program, which I'll ask Professor Murphy to speak to. Professor Kelly is available to answer any questions on any of these matters. But let me begin by telling you today, if we could have the first slide, these are today's numbers. Just under 1.8 million Australians have now been vaccinated, and I can tell you one of them is my mum. She was vaccinated today. She went down to her GP on the regular Thursday clinic, and she has had her vaccination today. Some 67,591 Australians were vaccinated in that previous 24-hour period, and we're pleased to see that those numbers have been staying in those sort of mid-60,000s each day, and that's good to see. It's also important to note that over half of the vaccinations that have been done in Australia have now been done by our general practitioners. And if I go to the next slide, you can see that since the general practitioners came on board, we've seen the vaccination program reach the levels that it has now of just less than 1.8 million. If I can have the next slide. What you can see now is Australia, which is here, has been steadily moving up the board. We are now at 7 per 100, which puts us ahead of the European Union, ahead of countries like Belgium and France and Italy, and of course countries like New Zealand and Canada at the same time of their vaccination rollout. And I want to say a big thank you to Australians, particularly those aged over 70, including my mum, who have been out there heeding that call to importantly go and ensure that they are getting vaccinated, because that population in particular, aged over 70, is the most vulnerable when it comes to there being any potential outbreak. Today, National Cabinet agreed the following, and I'll ask Professor Murphy to go through this in more detail. Once again, we enforced that Pfizer would be prioritised, the doses available for those under 50 in those 1A and 1B groups. They'll also be prioritised to those in residential aged care facilities and disability care in remote and very remote locations, and for quarantine and those essential frontline workers who are working in those areas which are vaccinated by the states and territories. We also agreed to bring forward for over 50s, so outside 1A and 1B, over 50 Australians. This would be vaccination for AstraZeneca, and that would be brought forward for the GP respiratory clinics and state and territories from the 3rd of May and from the 17th of May for GPs in the broader GP clinics that are available, just like the one my mother went today. That will give ample time for them to gear up to that. It'll also give more time for those GPs to focus continually on that over 70 population where they're working through very effectively at this time, and we thank them for that. State and territory Pfizer vaccine rollouts, which are currently being done, will also be available to workforce in residential aged care facilities as well as disability care. Now, that's not for disability care residents with highly complex needs. They will continue to be vaccinated through the in-reach services that are provided by the Commonwealth. And once again, National Cabinet affirmed the importance of GPs being the principal way in which we're seeking to vaccinate the country, and the fact they've already done half that job and that is only continuing to grow, I think underscores that.